Okay, I think we'll make a start. The time is 2 o'clock. So welcome everybody who's joining us on the webinar as an attendee, but also to those of you watching live on Facebook. We'll just start with some introductions. My name is Sonya Chowdhury. I'm Chief Executive of Action for ME.
And I'm Helen Winning, and I'm Chief Executive of the ME Trust.
Also got a couple of colleagues helping in the background. So we have Sam, Vic and Claire who'll be helping to field questions and make sure the technology works, etc. So the purpose of the webinar today is just really to respond to some of the questions that we've received about the merger, and also to set out a little bit more about how we see things happening. And I should say at this point that we're still working through quite a bit of the detail. The boards have made a decision to potentially go ahead and to merge, but we've still got some work to do. So we want to tell you a little bit about that today, and we may not be able to answer every question, but please rest assured that both boards have had an opportunity to see the feedback and the questions that we've received thus far, and anything else that comes through after today and indeed during today, we will be sharing with our boards as well. So we're going to start with two short presentations just to outline a bit more detail. And then we've got a series of questions we've received in advance, and there is an opportunity for you to be able to ask questions at the end of the webinar. And we also have colleagues picking up questions through social media. So I'm going to hand over now to Helen, who's going to start with the presentation for us. And Sam, if you can allow screen sharing, that would be great. Thank you. Okay, here we go. So let me just set this up. Okay. Over to you, Helen.
Thank you, Sonia. So just a brief introduction to the ME Trust and the work that we have been doing over the last few years. So we basically have a multidisciplinary team approach. We provide care to people with ME and CFS, and we also support their carers and their families. It's very important to us that we regard people as a whole individual. So whole person care is absolutely central to our ethos. We believe a person is more than just physical symptoms. We believe in supporting them in body, mind and spirit, and we offer medical services to support their physical function. We offer emotional support and counselling to support their mental health, and we also offer spiritual support through our multi-faith chaplaincy team. So the medical advice and intervention, as I said, as it says on the slide, is really delivered mainly through our doctor, our nurse and our physiotherapist. And then we have a team of counsellors, a team of chaplains who offer the counselling, emotional support and spiritual care too. We look after people who have a range of symptoms. Some of our patients have very mild ME. Many of them, in fact, have severe ME. We look after people who are adults, but also young people aged between 13 and 18. And a key aspect of our care is that we're not just a one-off appointment. We offer long-term support, follow-up after doctor's appointments, and long-term counselling, emotional support and medical support for as long as the patient needs us. Thank you. Excuse me. So a little about the people we have been helping. As you can see from this slide, we have in 2021, our last financial year, we did over 1,200, nearly 1,300 consultations, which was a big increase from the previous year. And I'd like to just say that this was during a period of lockdown and the pandemic. And the fact that we offer our services remotely by telephone and by Zoom and video calls means that we've been able to carry on helping people throughout the pandemic. that number of consultations represents a number of individuals, which again increased over the previous year to 260 last year. And that also, I think, represents, when you compare that with the consultations, that we often see people more than once. And it also represents the fact that people see more than one therapist at a time. They may well be seeing the doctor, but they may also have a counsellor, or they may have physio and then have some spiritual support too. So the people that we help, as I said, are adults and people from young people from 13 to 18, but about 50% of them are aged between 35 to 54. The vast majority are currently female and currently mostly white. So expanding our services to be able to cover more people across the spectrum is very important to us. Currently, nearly 60% of our patients live in London and the South East, but because we are able to offer remote consultations rather than face-to-face ones, it means people can access the service from all over the UK. And we also help quite a large proportion of people who have severe ME. If they're housebound and sometimes bedbound, then roughly 50% of the people we help can access our services because of the remote nature. What sort of impact are we having? Well, two very important figures here. 99% of our patients feel listened to and understood. And that's really key to any service for people with ME, especially as so many have been sidelined by mainstream healthcare, or not understood by their GP or by their families even. And the second important thing is that over 98% would recommend our service to other people. So we are, we believe, doing something right, and we want to carry on doing that. Just to give a little bit of flesh on those bones, numbers are one thing, but real people are something else. And these things are what real people have said to us. So following on from my previous comment about being listened to, you know, people say things like, more than anything, I was grateful to be believed, not judged and taken seriously, and at a price I could afford. So we do charge for our services, but we make it available to as many people as possible by subsidising the prices we charge through fundraising and by offering bursaries to people who are in financial difficulty. So another of our patients said, as you can see, that you guys are truly amazing. It's good to have that sort of comment. It's good to be appreciated. But the important thing is that we have been able to help someone all the way through their journey. And that the whole team, as it says in this comment here, are empathetic and caring. And we take great pride in that the people who work in our team really care and very often go the extra mile. The last comment here is from a parent, and I think that's important to know, because we do help families and people who care for people with ME, as well as the patients themselves. Sometimes, as I'm sure many of you were aware, it's very hard for someone with ME to have the time or the energy to be able to have long communication, and therefore having communication with the carers and the families is something that is very an important part of our work, and we want to support them too, and we often do through offering the carers and parents emotional support and counselling. Alongside that, we offer to our patients. So we hope we're going to be, well, in fact we intend that once we're merged with Action for ME, we will continue to offer these services, and we really hope that we're going to be expand the number of people delivering them, therefore the number of people we can help, and increase our geographical reach as well. So I'll hand back to Sonya, who'll tell you rather more about what's going to happen next.
Thank you, Helen. So as Helen said, I'm going to tell you a little bit about what we're going to do once we merge, but I just want to start by giving a small outline of some of the work that Action for ME does. So these are statistics from the last financial year. So that's the 1st of April up until the 31st of March. This very much is about our information support and advocacy service that we currently provide. We also have funding to deliver some medical education work, particularly in Scotland, working with Dr. Nina Muirhead and other charities to widen the number of GPs and others accessing the fantastic e-learning module that Nina has developed. We also work in the area of research. So as many of you will know, we co-founded the UK CFSME Research Collaborative, working with Professor Stephen Holgate and others. We've run a number of conferences and we worked tirelessly in the background to secure the funding for the Decode ME study, which we are co-delivering with the University of Edinburgh and a superb patient, public and involvement team. We also fund PhDs and have been working to get a fellowship funded. There's been lots of shifting around with what research is going to be undertaken within the fellowship, but we're working very closely with Solve ME in the US to work on that together. Next week, we have a webinar with Dr. David Strain, our medical advisor, and we'll be talking about some of the work that we're going to be doing over the coming year. And also David will be explaining some of the current thinking and links or not links with ME and long COVID. So today I'm primarily going to focus on our support services rather than cover the whole breadth. As you can see, we have what we call our primary support. That's people contacting us for information support. It can be anything from, I think I might have ME, to I've got long COVID, but it looks like ME, to I'm in desperate need of some support. Can you help me? And over the last year, we have had some very complicated situations that people have found themselves in, partly because of the pandemic, but also because of the difficulties in accessing services. All the people that contact us come through our primary support team, and you can see that we've had nearly 4,500 contacts last financial year, and that's about 70,000 hours worth of staff time that's gone into responding to those queries. We send out information and resources. We also signpost people to resources on our website. We have a high level of satisfaction in that from the primary support team. And we have a team of individuals that respond directly to the emails and the phone calls that we receive. And you've got a sense of some of the top areas that we're contacted about. Health and COVID-19 and emotional support are very high alongside ME, managing ME. Our advocacy service worked with 53 people last year. That's a lot lower than the number that we were aiming for. And that is because the needs and the level of support required is very, very high, much beyond what we were anticipated. And I think there's real sort of synergy with the work that the ME Trust does, that we will stay with people and be alongside individuals. In some cases, that's for a number of years, and in others, that may just be for a couple of months. We have 100% satisfaction in the advocacy service, and the top areas where people need support are social care, health, housing, and employment. And we know for many individuals, they're not well enough to be able to work, and often the support we provide is helping people to leave employment well with references intact and the financial support that they're entitled to. Like the ME Trust, we provide family support. We work with children and young people, and we also work with families. And you can see there that we worked with nearly 170 families in the last year. And on average, we have about 10 contacts with each of those individuals. Again, satisfaction is very high, and the key areas are education, health, membership, and also other forms of support that children and families need. We do a lot of work around reducing isolation, and isolation is the top thing that people tell us that they struggle with in our last survey of over 4,000 people. We have online forums, one for adults and one for children and young people. And on both of those forums, people tell us that it's a real lifeline. In the Children and Young People service, we have buddy writers, so people that write to other young people, so they've got contact with people their own age. We have pen pals, and we have young adults that we've trained and support to be moderators on our forum. And they work alongside the children and young people, making sure that everybody gets support, helping other individuals interact when they've just started. The Children and Young People magazine, Cheers magazine, goes out to over 600 people, and the Interaction magazine goes out to several thousand. All of these services will continue after the merger. We are not looking at reducing our services, we're looking at increasing them. And that doesn't mean to the detriment of the other work that we do. We will be continuing to build up our research work. We will continue the medical education work that we're commissioned to deliver. And we will continue with the Decode ME study and the priority setting partnership, both of which are hugely important research pieces of work that we're doing. So in terms of the difference that we make, we ask people to give us feedback in a number of different ways. And within the primary support service, we're really looking at individuals having an increased understanding of their rights and the options, for people to feel less isolated, to have increased communicating, confidence in communicating with professionals, particularly the health professionals and social care, and ensuring that they've got an increased knowledge of support available to them. In the advocacy service, that's very much also about rights and options, but also to help people improve their health and well-being as a result of being able to access services. And again, that's very similar within our family support service. One of the reasons that we want to merge is that by 2027, we want all children and adults with ME to have access to the health and well-being support they need. We know that that is not the case currently. So we've identified major gaps in current provision for children and adults with ME and their families. And there are some fantastic health practitioners, social care professionals out there providing much needed services. But we know that they're patchy. We know that, for example, in some areas, there is just absolutely no provision. And we know that there are mixed views around what people get and what they want and what they're unable to access. The ME Trust provides healthcare services, which we as an organisation together can help expand much more quickly. We want to be able to accelerate the access that people have so that they get the health and support they need. But we want to do that whilst also working with and alongside professionals. It's really important that we're not replicating the provision that people should be able to access. And we know that unless we step up and do something, people will continue to have a lack of access to the health and support that they need. So we put out a survey a couple of weeks ago to find out what people thought about the potential merger at that time. Alongside that, both organisations spoke with partners and others that we work with. We contacted all of the people who currently use our services. So between us, that's quite a large number, as you saw from the previous slide. And also we engaged with our donors. The survey that went out on social media had 143 respondents, but we've also had a lot of contact from people that have read written information and materials from us through our magazines, etc. About 42% of people broadly supported the merger, and about a third of those are individuals that had used Action for ME services. We know that people wanted to hear more and to understand what the plans were before making a decision, which is why we were keen to hold the webinar today. And about 17% of people said they had no strong feelings either way around the merger. And just under 10% of people said they don't support the merger. Of those, a few had used both of our services and others hadn't. So some of the themes that we heard back were very much about being stronger together, There were a number of individuals that said that there are too many charities, it's quite confusing, we think your voice will be stronger together. And obviously the work that we do through Forward ME will continue as an organisation, and this is very much shared by the ME Trust. We do believe that we have a stronger voice by uniting and working together. And indeed, we are all working together under Forward ME around the NICE guideline. There are weekly meetings happening, and we are ensuring that we work collaboratively. Many people talked about the better use of resources, the funding available and increased capacity with the potential to grow all of our services. Just as a reminder, we're not looking at stopping what we're currently doing. We want to grow, and we want to grow more quickly, because even with all the charities that exist at the moment, there is still not enough information, support, advocacy, healthcare services, etc., to meet the needs that are out there. And as I mentioned before, people said it's less confusing for patients and for individuals if charities can come together. And actually, when you've got limited amount of funding and you want to support all the charities, it makes it quite difficult to understand which one to support. We also had some negative and some neutral themes. I think it would be remiss of me not to mention a few individuals that fed back about concern about Action for ME's reputation, our previous involvement in the PACE trial. We have continued to work, as I said, as part of Forward ME to move the NICE guideline forward, and we're publicly supportive of the removal of graded exercise therapy from the draft guideline that came out some months ago. We understand that people still have a level of distrust, and I hope as we continue to deliver services that we can continue to reduce that distrust and work more collaboratively with the community as a whole in the way that we're striving to do through the Decode ME project. Some individuals were concerned about the ME Trust model, the fact that you have to pay to be able to access the service, and this should be free. And that is something that we will be looking at once we have merged. Some of the individuals that Action for ME works with would not be in a position to be able to pay for the support currently available through the ME Trust, and we do need to look at that. Action for ME services are free, ME Trust services are not currently. So please rest assured we will be looking into that. Some individuals felt that we're different organisations with a different focus. Some wanted reassurance about the fact that services wouldn't stop. And some, as I mentioned earlier, wanted to know how it would all sort of fit together. So in that vein, this is the jigsaw puzzle that I showed earlier on with some statistics. And as you can see, healthcare services fits with what we plan to offer. We're still working through some of the details, but the plan is that I will stay as Chief Executive of Action for ME, and we will launch Action for ME Healthcare Services with Helen as the director of those services. The registered manager, Jane Woodgate, will continue as registered manager with Action for ME, and that's because we have an application into the Care Quality Commission, which is something that the ME Trust currently holds and has had outstanding inspection results. And we want to continue with that level of confidence to the people who use our services or may use our services in the future. The clinical practice team will be doctors, a nurse, physiotherapists, multi-faith chaplaincy support, and counsellors. And we will be looking over the next couple of years to actually expand those services. In the past, the ME Trust provided a service in the southeast of England, an outpatient clinic, and that is certainly something, as the world starts to open up again, that we want to be considering. Of course, all of this needs financing, so we are already thinking about the fundraising work that needs to take place. And Action for ME has some money, our reserves that we will be investing into healthcare services, but also all of our other services. Over the last year, we have significantly increased the team, the individuals available to provide advocacy and primary support, etc., to make sure that we are there for all the individuals that need us. We know we've got more to do. We have waiting lists for our advocacy service, and we want to ensure that nobody has to wait any longer than they need to be able to access any of our services. We will also have a clinical governance subcommittee. So that's a subcommittee of our Board of Trustees who will continue to oversee the healthcare services to ensure that they meet the current standards and that we maintain an outstanding CQC or Care Quality Commission registration rating. The Board of Trustees from the ME Trust will move across. Some are going to join the main Board of Trustees, and others, alongside a couple of Action for ME experienced board members, will join the Clinical Governance Subcommittee. We are absolutely committed to ensuring that we continue to provide all of our services at the highest possible standard. So this now provides us for an opportunity for questions. So Helen has just come back to join us. You should be able to see Helen there on the screen. And I've got some questions that we've already received, as I mentioned earlier. So the first one is, will staff from the respective organisation successfully? I think it's a really good question. You never know with mergers how people are going to come together, but what we have done is to have a number of different sort of strands of work, which we've called work streams. And one of those is about people, making sure that we welcome people into the organisation, that we integrate effectively, that we manage the legal processes. There are quite complicated legal processes about individuals transferring in. And we have taken lots of legal advice from Allen and Overy, which is a law firm that supports Action for ME and has supported us for many years, and also from an organisation called Slaughter and May. Both of these are providing their services free of charge to the individual organisation. So no fundraised money is going to spend against the legal costs of the merger, which would have been quite considerable otherwise. I've got a question for you, Helen. Does the ME Trust provide the lightning process?
Definitely not. It's not something we've ever been involved with, and we would not want to be.
Thank you. And I think part of that question was also around the fact that it wasn't recommended as part of the NICE guidelines. So we want to ensure everybody that we fully support the revised NICE guideline, and a reminder that we're working as part of Forward ME with that. So when the new guideline, hopefully when the new guideline comes out, we will ensure that any services provided are aligned accordingly. So another question for you, Helen. Will the chaplaincy service be kept?
Yes, it will. Again, as I said in my presentation, it's something that we believe strongly, that people are not just a physical being, they have a spiritual dimension. And we want to make sure that people of all faiths or none can have the spiritual support that they want. So we will offer multi-faith chaplaincy and continue to do so.
And that really highlights the enhanced kind of service provision that the ME Trust has provided over the last 5 years or so. So again, another question around doctor service. Will the doctor provide assistance for patients to try off-label drugs? And this has been a really big issue, sort of in the field for a number of years, and something we've talked in the past to the Department of Health about. So there was a lot of interest around that.
It's not something that we're currently doing. To a certain extent, it may well depend on the views of the doctors that we recruit, and we will talk to them, and we will talk to Dr. Strain as well, the Action for ME advisor, about the best way forward with that. But it's not something we currently do.
Thank you. And I think that it's important just to highlight again that all of the individuals working as part of the clinical team have their own registration. They all work to their professional standards and bodies, and everybody delivering services covered through the appropriate insurance. And we recognise that there are difficulties in the systems and structures that are in place around prescribing off-label drugs, but that is something as an organisation we're keeping a very close eye on, and it is something that we would be keen to see and to learn from others in the States, etc. The next question's around overhead costs. So every organisation has overhead cost. Action for ME has over 30 staff currently. Some of those are what we would classify as an overhead. So managing payroll, the finances, all the processing, making sure that we've got the legal requirements in place, charities commission, etc. And and to some degree, the chief executive and administrators, etc., are overhead costs. If you want to know more about how we spend our money, you can watch the AGM where our treasurer set out how our money is spent. In terms of the merger, by coming together, there will be reduced overhead costs. We won't be having two CEOs. We won't be having two full sets of financial systems and processes. We'll be able to combine fundraising. One of the things that the boards considered on Thursday evening was how much a merger would cost and how much we would look to save in the future. So in the long term, we would certainly expect to have fewer overhead costs between the two organisations. Next question's around the services provided by the ME Trust. Can they be expanded so there are more doctors and face-to-face appointments to be offered in more areas of the country, whilst also keeping remote options available permanently as they make it more accessible for many, and a request for appointments in the east of England?
Well, definitely. That's one of the major purposes from our point of view of merging with Action for ME, is combining resources so that we will be able to expand the services. It has been our aim for some time to recruit more doctors, and we are currently recruiting several, I hope, in the next few months. And we will hope to resume face-to-face appointments when it's safe to do so. In the past, we have offered home visits for people who are severely affected. And again, that is something we will hope to offer in the future. Of course, it's geographically limited as to where our people are. So our aim would be that in the fullness of time, we will have hubs all around the UK where we would have a doctor, a nurse, a physio, some counsellors, chaplains, so that there can be face-to-face clinics, as we piloted in the Southeast a couple of years ago, and that we would be able to offer home visits. They're particularly valuable for things like physiotherapy or for an initial doctor assessment. So we will hope to do that. However, we have also found that during the pandemic, we've been able to help so many people through our remote services, as I mentioned earlier, and we will definitely be continuing the option of remote access via phone or by video. So yes, we will definitely be increasing services. That's the whole point.
Thank you, Helen. It's a couple of, and if I'm turning away, I'm reading questions on various screens and in front of me, and got some through that are coming through social media as well. So I do apologise if I'm not looking directly at the camera. We've had a couple that have come through the webinar function. First person says, I volunteer for Action for ME as a proofreader for the Interaction magazine. So firstly, thank you so much for all you do. It's a fantastic magazine, and I know so many individuals contribute to it. I also do audio recordings for the magazine. I understand that these roles will continue, which I'm pleased about. Do you envisage the tone and layout for the magazine staying broadly the same after the merger? It's a really interesting question, and we've got no immediate plans to change the tone and layout. It's not our magazine, it's your magazine, and what we will continue to do is to engage with individuals and get feedback. The feedback I hear all the time about the Interaction magazine is it's a lifeline. And if that continues to be a lifeline, then we don't want to make radical changes. What we will start to do is include information and expand what we're able to provide. We'll have a clinical team as well as our Dr. David Strain, who will be able to input. So we want to make sure that continues. We've had another question through Zoom. Will the services be available in Wales? All of Action for ME services are available across the UK, and I know that that's the same for the ME Trust currently, particularly given it's a remote service. We recognise that in the devolved nations there are even more difficulties than in some of the areas in England. So that is certainly something we'd want to be mindful of, and to make sure that we engage appropriately with the individuals and organisations, support groups, etc., across the UK as we look at what we will deliver. As I mentioned earlier, we hope that at some point we'll be able to offer outpatient clinics again in the future, but we need to work that through and make sure that we engage accordingly with the NHS and others. Another question here that's come through: will there still be a focus on promoting and funding around the GP training module in Scotland? We have got funding for another, I can't remember how many months now, but it was originally an extra 18 months. That work is continuing and is being led by my colleague Ruth, and we envisage delivering that project in full. So another question that we've had in advance here: we need charities to be really strong in opposing harmful treatments, whilst also helping patients to do the best they can in terms of symptom management techniques, including secondary symptoms like mental health issues caused by the isolation and loss involved in living with ME. As we mentioned before, there is access to counselling services through the ME Trust, but also online forums and other support that you can get through the current Action for ME services. All of those things will continue, and we envisage scaling those up, not reducing them. So we completely agree that we need to ensure that people have access to the support that they need, and at a time they need it most. Next questions around setting up services so that patients could be referred from the NHS, like acting like a private provider that clinical commissioning groups would fund referrals to. This could be very useful for areas of the country that have no NHS ME services. Helen, I think I'll ask you to take that one.
Yes, we have had some experience in the past of working with individual CCGs to provide services for our doctor and our physio in particular, and it's definitely something that we see as part of our future development. We really hope that as we can expand our service, we can become more available, and therefore we will be talking to CCGs in the areas where we have an opportunity to do so.
Thank you. Next question was very much about wanting Action for ME to focus more resource on research and campaigning for change, rather than providing therapies, medical services and replicating services offered by the NHS, which will benefit a small number of ME sufferers. At the webinar that I'm going to do next week with our medical advisor, Dr. David Strain, we'll be setting out some of the thoughts that we've got around that. We're in the process of developing our new 5-year strategy, which will set out what we're going to do and what we're not going to do over the next 5 years. And we are going to make both health and research more of a priority. You're absolutely right that we need to see more resources going into research funding. As a small organisation, we're never going to have the millions and millions of pounds that are needed to transform the research and ensure that we start to understand more about this disease and ensure that there are treatments available. However, what we will be doing is looking at the priority setting partnership, which is to identify the top 10 research priorities in a partnership between clinicians and people with ME and the carers. We have a fantastic steering group of individuals that have been leading that work, and they have just launched the interim prioritisation. So massive long list of priorities that we got from the first consultation has now been slimmed down, and we're asking people to prioritise those to enable us to find the top 10. As an organisation, we want to see those priorities funded, and please rest assured we will continue to work with the Medical Research Council, the National Institute for Health Research and others to ensure that we see change for the future. Many of you will have already heard me say that had we invested in research 30 years ago, when we're faced with something like long COVID and the pandemic, we might have understood more about post-viral illnesses. And therefore we have to ensure that things change for the future, because we cannot continue to have generations and generations experiencing the neglect and lack of access to support and care that we've seen in the past. And that really underpins why we wanted to merge with the ME Trust, but we will continue to campaign. We'll do that collaboratively with Forward ME, through the International Alliance for ME, working with Solve, working with others, and the Long COVID Alliance and other post-viral illness groups. There's a question here around charging for services. Mentioned this in the presentation, but as it was a specific question, just want to highlight again that we will be looking at what bursaries are available to ensure that those that really cannot afford to access services still have equity of access. The next question is about treatments from the ME Trust. Helen, does the ME Trust provide CBT, cognitive behavioural therapy, and graded exercise therapy?
Absolutely not. Our clinical team have never supported graded exercise therapy. And although some of our counsellors may have been trained in CBT, it's not the therapy that they choose to use with people with ME. We very firmly believe in following what we hope will be the new NICE guideline when it's published, which has discredited graded exercise therapy as a treatment and recommends not using CBT. And therefore that, will very much chime with what our therapists already do.
Thank you. The next question is, how will you work with BACME? So this is the British Association of Clinicians working within the ME field. We are not a member of BACME, but my colleague Ruth meets with the chair on a quarterly basis just to keep in touch and see what work's being done. We have the chair, Anna, is also an observer on the UK ME Research Collaborative. So there are a number of overlaps there. We're very interested to see what will happen with the NICE guideline and what impact that has for specialist services and treatments and therapies that are being provided. Obviously, the guideline has been delayed, so those discussions have not yet taken place. We need to see if and when the final guideline is released. The next question is again around funding for ME Trust services and what that might mean for somebody who makes a donation to Action for ME. So the question is the question is, does this mean my donations will no longer be used for the medical research for which it is intended? Anybody can give a charity funds that are to be used in a restricted way. Some people give funds so that the work of the charity can go ahead, and clearly that's important so we can deliver services, the work that we're doing around research, medical education, etc. If you are currently a donor giving to Action for ME or indeed the ME Trust, you are able to restrict that funding. So that means if you tell us that you want your money to go to medical research, we will absolutely use your donation for medical research and not anything else. That's also audited. We have an independent auditor that comes in and checks that we are looking after the money well. We're spending it on the things that we've said we were going to, or indeed we're spending it on the things that we've told you we will spend it on. And so there is a double checking in place with that. So we've got some more questions coming in. Will you be intending to increase the support services such as OTs as well as Safe Physio as a whole wellness approach? Certainly sounds like this will make ME services stronger. Could you expand on the spiritual side approach? So I'm going to hand those couple of questions to you, Helen.
Well, certainly the spiritual side is something that I think we've talked about before, and it's something that's very important to our whole person care model. So we will continue to offer people any spiritual support that they feel that they need.
Thank you. And did you want to say a little bit about the whether or not we're looking to increase support services such as OTs?
Not in the immediate future, but it is something we will certainly look at post-merger. At one point in the ME Trust past, we did have an occupational therapist, and it's definitely part of a range of support that we would like to consider.
Thank you. So the next question that's come in is outlining a situation where an individual's 16-year-old daughter was forced into graded exercise therapy through specialist, and which had a drastic negative impact on them. She's now nearly 17, has been dumped out of this service without any service at all. And I'm sorry, I can't quite follow the last little bit, but what I would say is that I'm really sorry that your daughter and you have had that experience. Action for ME currently provides a family support service. We work directly with children, young people, and we also work with parents. So if you wanted to make contact with us, then certainly one of my colleagues would be able to talk with you and see if there's anything we can support with. You can contact Action for ME on 0117 927 9551, or you can email questions@actionforme.org.uk. I think that's all the questions that have come through so far. I'm just checking, were there any more questions on the Q&A? Can't see any more questions coming in, unless, Sam, you tell me otherwise. So I think that leaves me just with the opportunity to say thank you so much for joining us, hear a little bit more about our plans. This is a developing piece of work. We still, as I said, we still haven't worked everything out. We want to make sure that the Care Quality Commission registration is in place, and we have allowed ourselves a couple more months for that to come through. It can take a while for applications to be assessed and to secure that registration. So we envisage the actual merger taking place later on in the autumn. We will communicate with you, and as we start to know more about what this is really going to look like, and obviously we will share that. I just want to flag again the webinar next week, which is with myself and Dr. David Strain, where we'll be talking about Action for ME's future plans. So that will be alongside the services that we've talked about today, but also to hear from David Strain around long COVID and ME. As an organisation, we are seeing an increasing number of people coming through wanting to access our service who have ME-like symptoms, or indeed have had a diagnosis of ME. We have to ensure that we're there to provide the support for those people who have ME and or think that they have ME. And so if you are one of those individuals listening, please do feel that you can pick up the phone. And indeed, if you're somebody that's had ME or been ill with ME for a long time, we will still be here for you. The merger is not about reducing services. It's about expanding and trying to do more. At the same time, we're trying to secure change for the future. So we will continue to work with the research funders, with others, to ensure that services increase, not decrease. Thank you so much for all your questions and for taking the time to join us today. The recording will be made available afterwards, as I know some individuals are only able to access information in short bursts. Thank you to Helen for joining me today, and also to Sam, Claire, and others in the background that have helped make this happen. Thank you.